I think the issue really is that we can see in both the developed world and the developing world that there's an enormous increase in the number of people who suffer from what's called non-communicable diseases. These diseases are diabetes, cardiovascular disease, some forms of cancer, even some forms of lung disease, and many of them are linked to predisposing factors such as obesity. And we're seeing a time bomb of these diseases literally ticking away and exploding in various parts of the world. The risk of getting a non-communicable disease in adult life is not simply due to the genes that you inherited from your mother and father. We're now realizing that in fact another story is even more important than just simply the genetic one. The way that the genes that we inherit from our parents actually interact with the environment in the womb before we're born. A considerable amount of the risk of non-communicable diseases is set up in our early lives, in human development, when we're embryos, fetuses, and even infants. Many of the systems of the body, our hearts, our kidneys, our pancreases, have been established during our early life in prediction of the world in which our parents thought we would live. Sadly, the world has changed over a generation. Diets have changed, the levels of exercise that we need to sustain our daily existence have changed. But if we find that we're living in a different world in terms of nutrition, exercise and so on, then we're not programmed to respond healthily to that world. This mismatch between the function of our bodies and the world in which we now live is one of the critical factors that's leading to the epidemic of heart disease, of diabetes, of some forms of cancer, especially in the developing world. If we can establish a focus to promote the health of women and young girls around the world, even before some of them become pregnant, we can pass on healthy messages to future generations. This world would look very different from the world in which we live today. It would be a world in which young people are not the victims of the diabetes, the obesity, the cardiovascular disease that is affecting so many of them around the world now. They take ownership and control of their lives and in relation to the world in which they live in ways that would promote a match between their bodies and the world. They'd be the architects of a new healthy future, not just for themselves, but for the next generation and the generation after that as well.